Good morning, Cedar Valley. This is Aisha Khalid. Welcome to Quiet Echo. Tom wrote to me last Saturday after my column on polio. I have been thinking about his letter for a week. He told me what he believed. Polio cases were already declining before the vaccine. Cases rose afterward. Children were harmed. The historical record has been scrubbed from the internet. He signed his name. I owe him an answer. I owe every reader and listener of this paper an answer. Here is what a week of reading the record taught me. The Qatar incident is real. In 1955, Qatar Laboratories shipped about 120,000 doses of polio vaccine containing live, unattenuated virus due to a manufacturing failure. 200 children were permanently paralyzed. 10 died. 113 of their family members and contacts were also paralyzed. 5 more died. 60 lawsuits followed. None of those children got their legs back. The harm is on the record. I do not pretend it is not. SV40 contamination is real. Between 1955 and 1963, 10 to 30% of the polio vaccine produced in this country was contaminated with simian virus 40 from monkey kidney cell cultures. 10 to 100 million Americans were exposed. Simian virus 40 is tumorigenic in laboratory animals. The Institute of Medicine concluded the human cancer evidence is inadequate to accept or reject a causal link. The question is open. I do not pretend it is closed. Vaccine-derived poliovirus is real. The oral vaccine used in this country until 2000 was a live virus capable of reverting to virulence. Between January of 2023 and June of 2024, the CDC counted 74 such outbreaks worldwide, with 672 paralytic cases across 39 countries. Today, more paralytic polio cases worldwide come from vaccine-derived strains than from wild virus. The COVID-19 mRNA myocarditis signal is real. The CDC officially acknowledges a causal association, especially in young men after the second dose, at roughly 5 to 10 cases per million doses. I am a physician. I have practiced for 20 years. I am not in the business of pretending. The history of medicine contains real failures. The children harmed by those failures are not numbers to me. I have read about the Qatar children. I have read the court records. I think about them. Now let me tell you what the record does not support. In 1952, before the vaccine, the United States recorded more than 21,000 paralytic polio cases. 3 years after the vaccine was introduced, the number was about 5,000. By 1960, it was about 3,000. By 1965, it was 61. The drop is not the continuation of an earlier decline. It is a 99% collapse following the introduction of the vaccine. Tom believes the cases were already falling. The CDC's own published data show otherwise. I have looked at it 3 times this week to be sure. The data are not scrubbed. The CDC publishes them. The World Health Organization publishes them. Our World in Data publishes them. The Institute of Medicine publishes its reports. The Qatar incident has its own page. SV40 has its own page. Vaccine-derived polio has its own page. The COVID myocarditis signal has its own page. The story Tom believes has been hidden is the story public health institutions tell, openly, about themselves. I want to say plainly what I am trying to say. Both things are true. The vaccines have failed in real and terrible ways. The vaccines have also ended a disease paralyzing 20,000 American children a year. A serious adult does not have to choose. A physician cannot choose. I sit with both every morning before I open the clinic door. I do my work now knowing Qatar and SV40 and vaccine-derived polio and the myocarditis signal. I do it anyway. The alternative is the curve I read in the CDC's own numbers. Tom, I am not going to convince you. I am not trying to. You have your own mind, and you are entitled to use it. What I am asking is what I would ask any patient who has read something frightening. Read the record yourself. Read the CDC pages. Read the Institute of Medicine. Read the court documents. The institutions are not hiding what you think they are hiding. They are not hiding the Qatar children. They are not hiding SV40. They are telling the story you think has been suppressed. Read it before you decide. Tom, you wrote me a letter. The door is open if you want to write again. So is the door for any reader, any listener who has been thinking about this. The porch is for the conversation. I want to say one more thing before I close. The hardest patients I see are not the ones who disagree with me. The hardest patients I see are the ones who have stopped trusting anyone. They have read something frightening, and they have decided every voice on every side is lying to them, and they have closed the door. I lose those patients to fear. The vaccines lose those patients to fear. The country loses something larger than I have words for when a person closes the door. I do not want Tom to close the door. I do not want any of you to close the door either. Disagreement is a door open in both directions. Distrust is a door closed in one. The porch we are sitting on, this paper, this podcast, the Facebook group, the kitchen table where you are listening this morning, all of it is built on the door staying open. Walk down to the clinic on Monday and tell me what you think. Cedar Valley News has a Facebook group. There is a conversation going on. If you want to join us, tell us what your own reading of the record has shown you. I will put the link in the show notes. This is Aisha Khalid, your host for today's Quiet Echo. Thanks for listening. Quiet Echo is part of the fictional Cedar Valley News series, written by Evan Swenson, publisher, publication consultants, and Claude Marshall, AI developmental editor. While the people and town of Cedar Valley are fictional, the Qatar incident, SV40 contamination, vaccine-derived poliovirus, the COVID-19 mRNA myocarditis signal, the cited CDC and Institute of Medicine findings, and the historical CAS account data are real.
You've been listening to the Cedar Valley News Podcast, where small-town voices meet the headlines shaping our world. From faith and family to front porches and fields. We'll be back with more stories connecting real lives to real events. Until next time, keep your porch light on, your faith strong, and your heart open. This is Cedar Valley News.